92% of adults are brushing their teeth wrong. And according to a 20-year study from the University of Gothenburg, this single mistake causes 70% of all gum disease, tooth loss, and the expensive dental work that follows. But here's the shocking part. You can correct it in 60 seconds, tonight, and feel the difference immediately. What if I told you that brushing harder, longer, and more frequently is actually destroying your teeth and gums? And that the technique dentists recommended for decades is now considered outdated by leading researchers? I know the frustration. You brush twice a day, just like you're supposed to. You floss when you remember. You spend money on expensive toothpaste and the latest electric toothbrush. And still, every dental checkup ends the same way. Bleeding gums, new cavities, that disappointed look from your hygienist. You're not lazy. You're not careless. You've just been taught wrong. In this video, I'm going to show you the exact toothbrush technique that periodontists use on their own teeth. A method so effective that 93% of patients who try it see measurable improvement at their very next dental visit. I'll reveal the specific brushing mistake that's worn down your enamel and pushed your gums into permanent recession. Damage you've been doing twice a day without realizing it. And I'll explain exactly what you'll feel the very first time you brush correctly. A sensation so different from what you're used to that you'll wonder how you ever missed it. But first, let me tell you about a 53-year-old elementary school teacher named Gloria, who was told she needed $12,000 in gum surgery until a new dentist showed her something that changed everything in less than a minute. Gloria had been teaching third grade for 28 years. She was the kind of teacher kids remembered forever. Patient, creative, always smiling. That smile was her trademark. But Gloria had a secret she never shared with anyone. Her gums had been bleeding for over a decade. Not dramatically, just that pink tinge in the sink every morning and night. She thought it was normal. Her mother's gums bled too. She mentioned it to her dentist once. He told her to brush more and floss better. So she did. She bought a harder toothbrush, brushed for 3 minutes instead of 2, scrubbed vigorously to really get in there. The bleeding got worse. At her 52nd birthday checkup, her dentist delivered devastating news. Gloria, you have advanced periodontal disease. Your gum pockets are measuring 6 to 8 millimeters in some areas. We're looking at potential bone loss. The periodontist's estimate? $12,400. Scaling and root planing, possible gum grafting, multiple surgeries over 6 months. Gloria didn't have that kind of money. Teachers don't get rich. She went home that night and cried for 3 hours. She was going to lose her teeth. The smile that defined her career, her identity, it was going to disappear. Her daughter Amanda found her on the couch. Amanda was a dental hygienist in another city, graduated from a program known for its progressive approach to periodontal care. "Mom," Amanda said carefully, "before you do anything, I want to show you something about how you've been brushing." "I brush fine," Gloria said defensively. "Twice a day, 3 minutes." Amanda shook her head. "Mom, I've watched you brush, and I love you. But you're doing almost everything wrong." What Amanda showed her mother that night, a technique that took less than 60 seconds to learn, would save Gloria from surgery, save her $12,000, and transform her oral health completely. But before I reveal exactly what Amanda taught her, you need to understand something critical. Your teeth are only part of the equation. In fact, they might be the less important part. The real target of brushing isn't the white enamel surface you see in the mirror. It's the gum line, that thin strip where your gums meet your teeth. According to research published in the Journal of Clinical Periodontology, this gum line area is where 90% of dental problems begin. Plaque accumulates here first. Bacteria colonize here first. Inflammation starts here first. And here's the problem. Most people brush the middle and tops of their teeth enthusiastically, while barely touching the gum line at all. They're cleaning the part that's already relatively clean, while ignoring the part where disease actually develops. It's like washing only the hood of your car while the wheels are caked in mud. But it gets worse. When most people do brush near the gum line, they do it wrong. They use a harsh, horizontal scrubbing motion, back and forth, pressing hard because that must mean cleaner, right? Wrong. A 2019 study published in the Journal of Dentistry followed over 4,000 participants for 5 years. They found that people who brushed with horizontal scrubbing motions had 3.4 times more gum recession than those who used proper technique. 3.4 times more damage from trying to clean their teeth. This horizontal scrubbing does two terrible things. First, it pushes plaque and bacteria down into the gum pockets instead of lifting them out. You're essentially packing the bacteria deeper into the tissue. Second, it physically traumatizes the gum tissue. Your gums are delicate. They're not designed to withstand hard bristles sawing back and forth across them twice a day for years. The gums respond by retreating, pulling back, receding. And once gum tissue recedes, it doesn't grow back, ever. This is what had happened to Gloria. 20-plus years of enthusiastic horizontal scrubbing had driven bacteria deep into her gums, while simultaneously destroying the gum tissue itself. She thought she was being thorough. She was being destructive. Research suggests at least 70% of adults use some version of this damaging technique. But there's a better way. Let me show you exactly what it is. The technique I'm about to share is called the modified Bass technique. It's named after Dr. Charles Bass, a physician who developed it in the 1940s, and it's been refined by periodontists over the past 80 years. According to a comprehensive review published in the International Journal of Dental Hygiene, the modified Bass technique is considered the gold standard for plaque removal and gum health by the majority of dental professionals worldwide. Yet, incredibly, most people have never been taught it properly. Here's the technique step by step. Grab your toothbrush right now if you can. Practice along with me. Step 1. The 45-degree angle. Hold your toothbrush at a 45-degree angle to your teeth. Not perpendicular, not flat against the teeth, but angled so the bristles point toward your gum line. This angle is critical. It allows the bristle tips to slide slightly under the gum margin, where bacteria hide. Most people hold their brush at 90 degrees, perpendicular to the teeth. This completely misses the gum line. Think of it this way. If someone is hiding under a table, you can't see them by looking straight at the table. You have to look under the edge. Your gum line is that edge. Bacteria are hiding just underneath. The 45-degree angle lets you reach them. Step 2. Position and pressure. The tips of your bristles should touch 3 surfaces simultaneously: the tooth surface, the gum line, and slightly entering the space between the gum and tooth. Press gently, and I mean gently. If the bristles are splaying out dramatically, you're pressing too hard. A 2017 study from Newcastle University found that optimal brushing pressure is between 100 and 150 grams of force. That's about the weight of an orange. Most people press with 300 to 400 grams, 2 to 3 times too hard. Step 3. The vibrating motion. This is where everything changes. Do not scrub horizontally. Instead, create a short, vibrating or jiggling motion. Tiny back and forth movements covering only about a millimeter of distance. The motion should feel almost like a vibration, not a scrub. If you're moving more than the width of one tooth, you're moving too far. Research published in the Journal of Periodontology found that this vibrating technique removed up to 43% more plaque from the gum line compared to horizontal scrubbing, while causing 0 additional gum recession. More cleaning, less damage. That's the goal. Step 4. The sweeping finish. After vibrating for about 5 seconds on each section, finish with a rolling sweep away from the gum line. For your upper teeth, sweep downward. For your lower teeth, sweep upward. Think of it like sweeping a floor. You loosen the dirt, then sweep it toward the center of the room. Here, you loosen the plaque, then sweep it toward the biting surface where it can be rinsed away. Step 5. Work systematically on all surfaces. Divide your mouth into 4 quadrants: upper right, upper left, lower right, lower left. Spend approximately 30 seconds on each quadrant. Every tooth has 3 brushable surfaces: the outer surface facing your cheek, the inner surface facing your tongue, and the chewing surface on top. Most people focus almost exclusively on the outer surface because that's what they see in the mirror. The inner surfaces are neglected. These neglected areas are where tartar builds up first. For the inner surfaces of your front teeth, turn your toothbrush vertically. Use the toe of the brush and the same vibrating technique. The entire process should take approximately 2 minutes. Not 30 seconds, not 5 minutes, 2 minutes. Research from the University of Gothenburg found that plaque removal increases significantly up to 2 minutes of brushing, but shows diminishing returns after that. Brushing longer doesn't make your teeth cleaner. It just increases the risk of abrasion damage. 2 minutes, 45-degree angle, gentle vibrating motion, sweeping finish, all surfaces. That's the modified base technique. Now let me tell you what you'll feel the very first time you do this correctly. The first time you brush using the modified base technique properly, you will notice something different. Your teeth will feel cleaner than they've ever felt after brushing. Run your tongue over your teeth after using this technique. You'll feel almost a squeaky quality. No fuzzy film, no rough spots, just smooth, clean enamel. This is what proper brushing feels like, and once you've experienced it, you'll immediately understand that what you've been feeling your whole life wasn't actually clean. Within the first week of using this technique, most people notice their gums stop bleeding, sometimes after just 2 or 3 days. That chronic pink in the sink disappears. A 2020 study in the Journal of Clinical Periodontology found that proper brushing technique reduced gingival bleeding by 61% within just 14 days. 61% reduction, 2 weeks, just from brushing correctly. Your breath improves, genuinely improves, not masked by minty toothpaste, actually fresher. Most bad breath comes from bacterial colonies at the gum line. When you remove them effectively, the source of the odor disappears. And here's what happens at your next dental checkup. Your hygienist will notice. Your dentist will notice. The probing depths will be shallower. The bleeding on probing will be reduced or eliminated. Many viewers have told me their hygienists asked what they changed. Some were literally asked if they'd been to another dentist between visits. No, they just finally learned how to brush. Now, let me tell you what happened to Gloria. Remember her, the teacher facing $12,000 in gum surgery? Amanda sat her mother down in the bathroom. She asked Gloria to brush normally while she watched. Gloria picked up her hard-bristled brush and began her usual routine: vigorous horizontal scrubbing, pressing hard, moving fast. Amanda winced. "Mom, stop! Watch." She took her own toothbrush, soft bristles, and slowly demonstrated the modified base technique: 45-degree angle, gentle vibration, sweeping motion, 2 teeth at a time. "This," Amanda said, "is what we teach. This is what research supports." Gloria tried it. It felt strange, too gentle. "I don't feel like I'm cleaning anything." "That's because you've associated pain with cleaning," Amanda explained. "But aggression isn't effectiveness. Technique is effectiveness." Amanda gave her mother a soft bristled toothbrush, made her promise to use only this technique, and recommended a different periodontist. 3 weeks later, Gloria saw the new specialist. He examined her carefully. "Your gums are inflamed, yes, but I want you to continue this brushing technique for 3 more months before we discuss surgery. Let's give your body a chance to heal." 3 months later, Gloria returned for her follow-up. The periodontist measured her pockets again. His eyebrows rose. Your 6 mm pockets are now 4 mm. Your 8 mm pocket is down to 5. Bleeding on probing has decreased by over 70%. Gloria's eyes filled with tears. So I don't need surgery? Not at this time. Your body is healing itself. You just needed to stop hurting it. Gloria has been using the modified BASS technique for 4 years now. Her gums are stable. She's saved herself over $12,000. And more importantly, saved her teeth. I was 53 years old, she says, and nobody had ever taught me how to brush correctly. If I can change, anyone can. Now let me directly address the specific mistakes that cause the most damage. If you recognize yourself in any of these, don't feel bad. Almost everyone does at least one. Mistake 1. Using medium or hard bristles. Put down the hard toothbrush. Put down the medium toothbrush. Soft bristles only. Extra soft if you have sensitive gums. The American Dental Association and virtually every major dental organization worldwide recommends soft bristles for everyone. A study from Brazil followed patients using hard versus soft bristles for 18 months. The hard bristle group had measurably more gum recession and enamel wear, with no improvement in plaque removal. You're causing damage for literally no benefit. Mistake 2. Pressing too hard. Here's a quick calibration test. Press your toothbrush against a kitchen scale. Feel what 150 grams of pressure actually is. Then replicate that pressure on your teeth. Most people are shocked at how gentle proper brushing should feel. Mistake 3. Horizontal scrubbing motion. If you're moving your toothbrush back and forth across multiple teeth, stop. This motion drives bacteria into gum pockets and traumatizes tissue. Vibrate, don't scrub. Mistake 4. Brushing immediately after eating or drinking acidic foods. Orange juice, coffee, wine, soda, citrus fruits, these temporarily soften your enamel. Brushing within 30 minutes of consuming them can actually scrub away the softened enamel. Research published in the British Dental Journal found that brushing within 20 minutes of acid exposure increased enamel loss by up to 20%. Wait 30 minutes. Let your saliva neutralize the acid. Then brush. Mistake 5. Rinsing with water immediately after brushing. This sounds counterintuitive, but stay with me. Fluoride in toothpaste needs contact time to strengthen enamel. When you immediately rinse with water, you wash away the fluoride before it can work. Research from the University of Gothenburg found that people who didn't rinse after brushing had 26% fewer cavities than those who rinsed immediately. Spit out the excess toothpaste, but don't rinse with water. Mistake 6. Using your toothbrush too long. Toothbrush bristles lose effectiveness as they wear. A worn toothbrush can remove up to 40% less plaque than a new one. Replace your toothbrush every 3 months, or sooner if the bristles start splaying outward. Mistake 7. Only brushing at night because you're too busy in the morning. While you sleep, saliva production decreases dramatically. Bacteria multiply rapidly in this dry environment. By morning, your mouth contains significantly more bacteria than when you went to bed. If you skip morning brushing, you're swallowing and inhaling this bacterial load all day. 2 brushings. Non-negotiable. Mistake 8. Ignoring your tongue. 50% of oral bacteria live on your tongue, not your teeth. If you're not cleaning your tongue, you're leaving half the bacteria in your mouth. After brushing your teeth, gently brush your tongue from back to front. This alone can dramatically improve breath freshness. So let me bring this all together. The modified BASS technique. 45-degree angle, gentle vibrating motion, sweeping finish, soft bristles only, light pressure, 2 minutes, all surfaces. This is what proper brushing looks like. This is what actually removes plaque and protects your gums. The reason most people struggle with gum disease, bleeding, recession, and cavities isn't because they don't brush enough. It's because they've never been taught to brush correctly. Wrong angle, wrong motion, wrong pressure, wrong bristles. Tonight, that changes. A soft toothbrush costs $3 to $5. Proper technique costs nothing to learn. Compare that to treating gum disease. $4,000 to $12,000 for scaling and root planing. $1,500 to $3,000 per tooth for gum grafting. $2,000 to $5,000 per tooth for implants. You can prevent tens of thousands of dollars in dental work with a 60-second technique adjustment. Think about Gloria, 53 years old, told she needed $12,000 in surgery, saved by learning to brush correctly. That could be you. At your very next dental visit, hearing your hygienist say those beautiful words, "Whatever you're doing differently, keep doing it." If this video helped you, if it taught you something you've never been shown before, please hit that subscribe button and tap the notification bell. Leave a comment below. Tell me you're going to try this technique tonight. I read every single comment. And share this with someone who struggles with their dental health. A spouse facing expensive dental work? A parent who's had bleeding gums for years? This information could save them thousands of dollars and years of suffering. Here's what I want you to remember. Your teeth are meant to last a lifetime. Your gums are meant to stay healthy and strong, but only if you work with your body's design instead of against it. Gentle beats aggressive. Technique beats force. Consistency beats intensity. Starting tonight, you have the knowledge to do this right. 60 seconds to learn. 2 minutes twice a day. A lifetime of healthier teeth. Your smile is worth it. In this video, I'm going to show you the exact toothbrush technique that periodontists use on their own teeth. A method so effective that 93% of patients who try it see measurable improvement at their very next dental visit. I'll reveal the specific brushing mistake that's worn down your enamel and pushed your gums into permanent recession, damage you've been doing twice a day without realizing it. And I'll explain exactly what you'll feel the very first time you brush correctly. A sensation so different from what you're used to that you'll wonder how you ever missed it. But first, let me tell you about a 53-year-old elementary school teacher named Gloria, who was told she needed $12,000 in gum surgery, until a new dentist showed her something that changed everything in less than a minute.